Thank you for the invitation to talk about my experience with the percutaneous myofasciotomy in patients with muscle shortening due to spasticity following traumatic brain injury, stroke, or cerebral haemorrhage, and in patients with cerebral palsy. We know several techniques to do a soft tissue release, and I only want to talk about the percutaneous method. The percutaneous myofasciotomy. The principles: it's cutting the fascia with a special knife or needle, splitting the fascia, and gaining muscle function. There's no damage to the functional muscle, no large incision, and possibility of many corrections during one anesthesia. The advantages: it's a minimal invasive procedure, short time needed for the surgery, low loss of blood, minor scarring, low risk, high potential for corrections. The reoperation is possible and can be combined with complex bony corrections or other soft tissue treatment, and it can be performed ultrasound guided. Here it's a example how it works. You see the black thing on the right muscle is the shortened fascia. You go on with a special knife, you cut the fascia, then you bring the whole system under tension and you gain movement. This shows us, the rubber band shows us the healthy muscle, and with a plastic it shows the shortened fascia, and then you go special knife on the plastic bandage and you cut it and you touch the healthy muscle underneath, but don't hurt them, and you gain just movement. This is our preoperative preparation. This is how the instrument table looks like. And this is an example for the technique. You can see that we feel and we touch with the finger and with the knife. And finally, we have only this little puncture here. It looks like if you took some blood from the patient. A muscle that is very often treated is the musculus gastrocnemius, or the calf muscle. Here, treating in a child, it's about 30 degrees too short. And then you go in with the, and here you can also see the cutting and the jumping of the knife over the shortened fascia, and we go in. Second time. And finally, we of 40 degrees, around 10 degrees over the zero position in the ankle. Or this example in an adult patient after stroke. You feel the shortened fascia, you go in with the needle and you perform the fascia lengthening on 3 levels, as you can see. Movement after the treatment, we gain about 30 degrees more movement in the ankle. And the aftercare is either a bandage or a soft cast for the hand or for the foot, used as an orthosis. And this looks the scar-like. If you see one, sometimes you have only a scar looking like this or looking like this. We started in 2008 and till 2023 we treated about over 7,000 patients, and as you can see, there's a change. In the last year, there came more patients only for treatment of the arms, separate from treatment of the legs. And what you also can see, even during the time of the pandemic, we treated around 500 patients a year with this method, because it's a short stay in the hospital and a short time of this anesthesia. These are some results. We've seen an increase of the passive and active movement. We've seen more power. We've seen no overcorrection and functional improvement for the upper extremity, active and passive. But we have also seen, especially in the children, a recurrence rate depending on the degree of the spasticity and the growth and the age of the patient at the time of the first surgery. And it's around 60 to 80% after 3 to 5 years. And we have seen some complications in over 7,000 cases, some vessel disease, some nerve disease, some bigger hematomas, but overall, compared to the open technique, it's under 1%. And these are some subjective results: better talking, not only words, but also phrases, increased walking distance, less or no salivation anymore, can eat gummy bears with both hands, more self-confidence, can use the hand better, play cards, hold yogurt cup, smaller orthotics or no orthotics anymore. You are the surgeon, thank you for my food. Here's some clinical results. This is a guy who could not open his hand anymore after closing and before the surgery. Result 1 year after the treatment. His hand changed into a good helping hand, and after 3 years, more power in the hand and still a good movement. She had a shortening of the 4th and 5th finger. The situation after the surgery. Right. Walking on a equinovarus foot with shortening of the calf and the musculus tibialis posterior. And this was the result 3 months after the surgery. You can see she is walking on both feet almost similar. And the was that she can stand on one foot, even on the treated one. And I was happy to see her after the first surgery, or after the surgery. There was no recurrence. She was still walking similar. She could stand on the treated foot, and you only can see that the muscle is not that big compared to the other side, and she could walk backwards. Or this patient, before the surgery, a tall walker, and after the surgery, almost a normal walking situation. This patient, I got to know he lost a lot of blood, and he developed a very bad spasticity of all extremities, and I got to know him in this position. There was first treatment of the legs, and then the walking in the locomat. I think it was 2 months after the surgery. And how he developed walking without orthosis with 2 helping persons, and then walking only with 1 helping person, only with normal sport shoes. And in the meantime, we took a look at the arms. They were like this. He couldn't use them anymore. And then we performed a facial lengthening here as well. So at the end, he can use both hands for eating and just for little activities again. This was the last picture I got from him, standing alone in a good position, with a good position of the arms and the legs. For this patient, he had a heart attack, and he had a very bad shortening of the hamstrings and the calf muscle, and he couldn't walk and stand anymore. As you can see here, a very bad shortening. And then we performed the myofasciotomy, and he went back. Rehabilitation, and after 3 months I got this picture. It's the same patient walking during the rehabilitation on the ground floor and looking very happy, using normal shoes. And I don't really know why he's going to this walking aid, because he's walking without this very, very good. Or this young patient, he had a heart attack as well. He was a golf trainer, and it was a very bad situation for him, and he recovered step by step. And finally, there was the main problem, shortening of the muscles in the legs for coming back to work. You can see he has a lot of energy to go back to work. And finally, we performed the myofasciotomy, and in the meantime, he married and he was able to drive his bicycle again. These are some pictures he sent it, and then he sent it a last video, and he told me that I should show you everybody, and he invited me to get to learn golf technique, and he's back to work, and he's working again as a golf trainer. So, the summary is the percutaneous myofasciotomy is a fast operation technique with less post-surgical pain, shorter recovery, can be combined with bone correction or other soft tissue management, and has a very high acceptance by patients and parents. The midterm outcome indicates that there is a persistent corrective effect with improvement of individual function and significantly improved quality of life. And the post-operative adjustment of ptosis is more favorable if it's necessary. And in the meantime, we did some science. Last year, this article was brought to a very big journal, and it shows that the influence of the percutaneous myofasciotomy has a good effect on the walking in children with cerebral palsy. And this is an original picture from the Black Forest. Those two persons visit us every week, and they bring a lot of fun on our children's station. With some pictures from Munich, I thank you for your attentions. And if you have any questions, you can always write me an email and I will answer as soon as possible. Thank you und Dankeschön.